We get this question a lot from pediatric providers, from emergency room providers, from parents. Febrile seizures, or seizures with fever, are very common in childhood, and do not necessarily place a child at higher risk of epilepsy, but there is a higher rate of epileptics that do initially present as febrile seizures. And so that is a very good question, because some children who have a fever and a seizure do not necessarily need an extended workup, but some actually do go on to have a diagnosis of epilepsy. Typically when you visit with the pediatrician or with the neurologist, they'll explain to you that there are two types of febrile seizures, both simple febrile seizures and complex febrile seizures. And that's really what determines for medical personnel when we do additional testing and when we don't. Seizures that are prolonged and extended will often, patients who have seizures that are prolonged and extended will often require an EEG to see if there is an indication or any hint of an epilepsy that may be the source of that seizure. Patients who have a seizure that involves only one part of the body also have a higher risk of actually having an epilepsy, and so those patients will usually be recommended to have an EEG. Patients who have a seizure who don't really have a high-grade fever. So if it was a fever of 99.9, those are patients that I'm usually sending for EEG as well, because we typically associate febrile seizures with a more robust fever than low-grade fever. Patients who don't go back to themselves rapidly after a seizure with fever, we often will recommend to have an EEG as well, suspecting that there might be an epileptic cause for that seizure rather than just febrile seizures. And so there are specific instances where having a febrile seizure will increase the likelihood that a physician will recommend further testing, but not necessarily. For febrile seizures, once a child has had one, they're more likely to have other febrile seizures, and so the best thing to do is, if there is no further workup, meaning EEG or imaging techniques, just develop a plan with that provider. Is there any further testing or medication that's indicated, or is this something that we can expect to see infrequently over the next few years? We do know that trying to pre-treat a child with Tylenol or ibuprofen in order to prevent a seizure due to fever is not easy and is not largely effective. And so having a good plan with your provider about what to do the next time it should occur is going to be pretty helpful. But not every child who has a seizure in the context of fever does develop epilepsy.